So today we're doing a reaction video of do eye exercises actually work? I tried for 30 days. And this comes from the creator Ed Progress. Now this is always a fascinating topic for me, and it's loaded with some controversy in the eye care field, right? This whole idea that, eye exercises to improve vision. And I actually have a collection of books that I have on this, so I'm excited to see what this creator has to say and break down some fact versus fiction. First thing right away is the thumbnail. It shows him going from a -2 power of glasses on one side to a -1.75 on the other, which is not really much of anything in terms of dioptic power of glasses. That's like moving your glasses down your nose like a few millimeters.
That's why I trained my eyes for 30 days, to show you whether eye exercises and a special tool could fix that. In today's life...
Wow, well, the editing certainly gets my attention, and special tool. We'll have to see what he's doing.
In today's life, there are 3 things that affect our eyesight in a negative way. We look at our smartphones and computers for many hours a day. That way, we train our eyes to get used to that particular distance.
So he's saying that there's 3 major things that affect our vision today, and number 1 is that we are using digital devices like all the time, and that in what he said is that they train our eyes to focus on one particular distance. So there's a sliver of truth to this in the sense that we do spend a lot of our time on digital devices. I'm on my phone, computers all the time, but they don't necessarily damage the eyes or cause them to get worse. For young kids, the more time they spend on near devices or just doing near work in general, not specifically computer devices, that has been shown to increase the likelihood of ending up with stronger levels of nearsightedness or myopia. But for a grown adult, it's not going to necessarily drive stronger need for glasses or making your eyes worse, but it can cause higher amounts of eye fatigue or even kind of an accommodative lockup where your eye muscles kind of get stuck in one position.
Spending the majority of our time inside. According to the EPA, the average American spends 93% of his life inside. And the average room is less than 20 square meters. It's like putting our eyes in a cage.
So number 2 here, he says, is because we spend so much time indoors. That is also true. We do spend a lot of time indoors. And again, there is an association between the amount of time spent working indoors, especially for young kids, in developing or progressing in levels of nearsightedness and myopia. However, as an adult, sure, if you're living in a really small apartment or working in a really cramped workspace, then your eyes will use what's called proximal accommodation, where you do inherently start to flex and focus on closer objects. And again, that could contribute to things like eye fatigue, but it's hard to say that that's going to drive the need for stronger glasses. Just not likely. Again, for young kids, yes, but for an adult, no. The other kind of part of number 2 here he's suggesting is that somehow focusing on one set distance with your eyes, like your computer screen, for a long period of time will weaken your eye muscles or the flexibility of your eyes in some way. Unfortunately, I think this creator just has no understanding of how eye muscles and the optical system of the human eye actually works. Focusing on one accommodative distance for a long period of time isn't going to make you lose your accommodative amplitudes or flexibility of the lens inside the eye. There is a normal aging change where you lose some of that flexibility that we call presbyopia, and doing some more regular kind of exercises near and far may help prevent or push off that flexibility loss a little bit with age. However, you live long enough, eventually you lose that flexibility.
Number 3. We don't move our eyes properly. Without movement, there is less blood flow in your eyes, and every body part that is not well perfused with blood will degenerate.
Unfortunately, this is not true at all. The eye muscles are very specialized in the human body. They are different versus the skeletal muscle in your arms and your legs. The movement of the eyes is very complex. Ocular motor movements is like a whole very niche specialty in the field of eye care. But the lack of moving your eye muscles around, I don't think that's necessarily true. People use their eye muscles all day long. Even if you're just sitting on a computer, you're using your eyes to shift back and forth, up, down, left, right. And maybe I can agree that we don't necessarily always extend into extreme gaze in different directions, because usually when you do that, it's slightly uncomfortable. But as far as this leading to a lack of blood flow and somehow leading to a degeneration of the eye, absolutely no scientific basis for that. Blood flow to the eye and to the retina has really nothing to do with your eye muscles.
The moment I put on my glasses for the first time, I felt like...
Is this real life?
Unfortunately, I hate wearing glasses.
So he's commenting on how he felt weird wearing his glasses. They certainly gave him a +10 intelligence, but he felt weird and didn't like wearing his glasses. And, he's not alone. A lot of people, even myself, feel like a tension or kind of a weird feeling wearing prescription glasses, especially if they are a high prescription. And that's because glasses themselves, versus like contact lenses, for example, create more of an optical distortion through the lens. It can make the world seem kind of warped in a way. And this is even a bigger deal if you have some correction for astigmatism, because the cylindrical lenses we use for astigmatism can create more of a warpage. In fact, that's the number one reason why most people come back to their eye doctor to kind of fix their glasses, because their new prescriptions make them feel motion sick or weird, and that's usually a change in the astigmatism correction.
But was always too skeptical and too lazy to give it a try. Well, eye surgery would be another option, but hey, that's too easy and too expensive.
Not sure what he means by eye surgery being too easy, because eye surgery is not easy at all. It takes a lot of years of education, training, and expertise to know what you're doing and how to fix things if things ever go wrong. As far as expensive, eye surgery can get pretty expensive. Some of the lasers that are used for eye surgery can cost up to like $500,000 for like a used one, so it can be expensive.
That's why I have no other option but to start training my eyes.
Well, you do have other options. You could consider contact lenses, maybe ortho-K contact lenses, or perhaps, again, talking with your doctor if they have some other form of correction or other type of glasses that maybe wouldn't make you feel so weird or sick, right? Maybe there is something else going on and causing you to not like your glasses.
To see any difference, I have to take an eye test before and after the challenge. So here are the results. -2.0 diopters on both eyes before the challenge. Let's hit the workout.
Okay, so one, I like that he is doing an eye exam before and then after, and he's showing some numbers here. It looks like he's mostly around a -2. He's got a little bit of astigmatism, it looks like, but I think probably my biggest questions, if you're really going to do a true test like this and really kind of look at all the factors involved, I would love to know, did he get a dry refraction or a wet refraction? And if you've never heard of that before, in the eye care world, if you go in to see your eye doctor and they ask you, hey, is this better 1, better 2, and they determine your glasses prescription, and they didn't put any eye drops in beforehand, we refer to that as a dry refraction. A wet refraction is where we use eye drops that not just dilate your pupils a little bit, that's helpful for the doctor to look inside the eye, but those eye drops can also have a cycloplegic effect, where they paralyze the ciliary body muscle inside of the eye. Because some people will come into the eye clinic, especially young kids, they can flex their muscles inside of the eye so strong, sometimes without even them realizing they're doing it, and that can throw off the whole process of not only determining a prescription from a doctor, but also just asking, hey, is this better 1, better 2? Because people who are nearsighted and even farsighted tend to use their eye muscles a little too much. Or during the exam, when we ask somebody, hey, does this look better 1, better 2, they consistently ask for more and more minus power in their glasses. And so then they end up being what we call over-minused. and then they have a glasses prescription with too strong of a power. And so that would be really helpful in knowing, did he get a dry refraction or a wet refraction? Because a wet refraction with cycloplegic medications would kind of improve the confidence in his numbers. Also potentially NRA, PRA testing and accommodative amplitudes and even vergences. All of that testing would be really interesting to see before and after.
The training itself is quite easy. Sit down and make yourself comfortable. Warm up your eyes by blinking for 30 seconds to oxygenate and moisten your eyes. Then intensify the blinking for another 30 seconds.
Okay, so the first exercises of just relaxing, all for that. That's good for everything. The blinking exercises, so funny enough, there is a little bit of truth to blinking exercises. In fact, we reported on a video about a year ago. There's some decent good publications showing that doing just simple blinking exercises several times a day can improve not only tear production on the eye, but improve kind of complete blinking and the frequency of blinking, because a lot of us spend so much time on computer screens and we don't blink enough. So there may be some utility to that.
The next few minutes focus on something in front of you and just move your head left and right without moving your eyes off the object. Additionally, try some patterns. The critical part is that you move your head as far as you can. If it's a bit exhausting for your eyes to stay in place, then you are doing everything right.
So this exercise where he's moving his head and keeping his eyes stationary on one object, that is utilizing the vestibulo-ocular reflex, really the communication between the inner ear and the eye muscles to maintain kind of a clear, singular object and being able to track things. I don't know how this could logically lead to any change in somebody's glasses power. Yeah, there's no way this is going to, change the eye muscles and somehow influence the length or power of the eye. But, maybe you'll have less motion sickness.
For the next one, keep your head straight while your eyes move around. You can do it in many variations. Left to right, up and down.
So this last exercise are him doing what are called versions, where we have you look in far extreme angles or directions of gaze. And in fact, we do this in normal routine eye exams. We always evaluate to make sure you can look in all different directions and use your eye muscles effectively, because if there's something that's off, that'll tell us that there's an issue with an eye muscle, perhaps a neurological connection to those muscles, or maybe an entrapment of some kind. Again, he's commenting that somehow the stretching of the muscles is somehow going to logically lead to a change in glasses power. Unfortunately, no.
The sessions took approximately 10 minutes each day, and I used a specific tool. Some fancy glasses. They are called pinhole glasses.
So I kind of figured he was probably using something like this. I have so much to say about pinhole glasses. But first, let me see what else he has to say.
It's a very interesting feeling, but after a few minutes you will get used to it and your eyes will see much clearer in the distance. For example, I can read the lowest part of this paper while standing here. Wearing the pinhole glasses, I can take a step back and still see the smallest letters from this distance.
Yeah, because that's what they do. That's how they work.
And it even seems like the effect lasts after you take them off. If you want to read about some benefits, you can look up these studies.
So pinhole glasses, if you've never seen or heard of these, we actually use them in the eye clinic, except we use pinhole occluders. Now, the concept is that in the smaller pinholes, they increase your depth of field. In fact, the pupil of your eye works on the same principle. The smaller your pupil becomes, the greater kind of depth of clear vision you get looking at all distances, far away and up close. However, it only really works for refractive purposes. So in the eye clinic, if I have a patient that comes in because their vision suddenly changed overnight, or they felt like it's getting worse, and we can have just one of our staff members ask them, hey, put this pinhole occluder over your eyes. Does your vision seem sharper? Are you able to read farther down the vision chart? And if they can, then we know that their vision change is due to a refractive means, meaning it can be corrected with glasses, contact lenses, etc. But if somebody comes in and their vision's worse and the pinhole occluder doesn't improve vision, then we have to think that there might in fact be something like wrong with something internally inside the eye. Like, is there bleeding inside the eye? Is the retina damaged in some way? That's kind of what we use the pinhole occluder in the eye clinic for. I'm interested to see what these research studies have to say, so let me actually pull these up. Okay, so I looked up these research studies that he's referencing, and I don't know if he actually read them because, funny enough, they say the opposite. They actually go against entirely what he's saying, that yes, while you're wearing them, they can improve your depth of field and help you see a little bit better when you're not wearing glasses. However, they don't cause a long-lasting effect of your vision, like improving your eyesight in any way. And in fact, they even say that these pinhole glasses can cause more issues, right? They actually cause a lot more eye strain, fatigue, and because they can limit your peripheral vision, your side vision, they make everything much dimmer, you might be at higher risk of, falls, tripping on things, and they may, again, cause more irritation and fatigue. The only time I could maybe hypothesize or think of a way where a time where pinhole glasses could in fact help somebody not need stronger glasses is if somebody is having an accommodative spasm. Their eye muscles, the ciliary body inside their eye is kind of stuck in a flexed position, and they started wearing pinhole glasses to kind of, maybe not rely on their regular glasses as much. If their regular glasses were kind of over-minused in the first place, maybe. But I think that person probably, even if they just didn't wear glasses at all for some time, maybe they would slowly let go of that muscle contraction. But again, while wearing it, they might in fact make things worse, feel more fatigue, and perhaps trip and fall on something. Most of the time, these pinhole glasses, you see advertisements for them. They make crazy claims, again, that's going to reverse your need for glasses. Only momentarily while you're wearing them. It's not going to have a long-lasting effect. However, interestingly enough, new medications for presbyopia work on this same principle. They're drops that you put in your eyes and they cause your pupils to get smaller, and they improve your depth of field. And that helps you read better up close without having to reach for reading glasses when somebody needs them over the age of 40.
But what we all want to know is, does eye exercise actually work? After 30 days, I returned to the optician and I was shocked about the results. I've got perfect vision.
This one was invented by a writer.
Well, actually 1.75 diopters on both sides. So my vision increased by 0.25 points. And I noticed that I could see details in my daily life more clearly.
So the change of 1/4 of a diopter in power within 30 days, not statistically significant. Honestly, that could be him leaning forward in the office chair while they're testing his vision. That could be maybe his doctor did give him a little bit too much minus the first time around, or perhaps he, again, was doing a dry refraction and he over-accommodated during that testing, and there's this slight, plus 1/4, minus 1/4 is really not that significant. Really, what they should have done during the exam would be a duochrome red-green test. That might even be a little bit more specific of determining if he was maybe given just slightly too much minus that first time around. So during the red-green test, if you see the letters on the red side more clearly, then we usually have to add more minus to bring the light focus better on the center of the retina. And if somebody sees the green more clearly, then we add more plus. And ideally, we want it so that both red and green sides seem equally clear, sharp, and bold in focus. This is the way to make sure we're not giving too much minus or too much plus in a prescription. But probably the most useful test, if this was going to be like a repeated study to really determine if eye exercises were going to improve vision, reverse myopia, you would want to do a test for axial length. In fact, a lot of eye clinics use this now for young myopic patients. We will measure the length of the eyeball internally and determine and kind of follow that over time, as people who have longer eyeballs with nearsightedness have higher risk for certain eye diseases, right? Cataracts, glaucoma, for retinal detachments, and myopic maculopathy. So you could theoretically measure the axial length at the beginning of the study and then afterward to determine if the axial length of the eye changed because of eye muscle posture acupuncture, or really anything. And I'd want that on top of doing a cycloplegic refraction, on top of doing accommodative amplitudes and vergence testing. Either way, though, even if this creator did legitimately feel like his vision changed within 30 days, that quarter of a diopter change, I bet it was for other reasons, not because of the eye muscle exercises. I don't think that he made this video with malicious intent or to spread misinformation on purpose. I know there's a lot of videos online on every social media channel that kind of talks about these sort of theories, and believe me, there's a lot of different theories of how these type of exercises work. It seems like I don't know where he got these ones from, but it kind of falls onto this idea that somehow the tension in the eye muscles and if you were to relax the extraocular muscles and the muscles on the outside of the eye, that somehow that would maybe change the shape of the eye and reduce the need for glasses. But the vast majority of the time where people do break their glasses, lose their glasses, or maybe just take a vacation from them, and then they come back and say like, hey, I can see better. I don't need as strong of a glasses prescription. It's usually because they have been using their eye muscles internally, the ciliary body muscle, too much, and they are kind of locked in an accommodative spasm, or they are somebody who has been progressively over-minused for many years. I thankfully don't see it too often, but this is where you come in to see the eye doctor. Again, they didn't do like a cycloplegic refraction, and they're already somebody's over-accommodating during the testing. Doctors are trained not to give too much power, but it does happen sometimes. Some people really love the feeling and the vision they get when they have slightly more nearsighted power prescription. If this happens one year and then they come in the next year or they go to a different doctor and that person then wants even more power because it feels good, and then the next year after that they get even more power. So after 3 to 5 years, suddenly they're like a full diopter power over minused, and they usually come in complaining of eye fatigue and they just need a new prescription, and it's like, actually no, you have too much power, so I actually have to back you off. No joke, that happens quite a bit with new patients that come into our clinic. I will find that they're over-minused by other providers. And then some people even make the claim that wearing glasses somehow makes your vision worse, which for adults, isn't true. A lot of people who may be walking around for months, even years, with pretty functional vision, but they're maybe not corrected optimally, they see, well enough to get around. They can see their phone, they can see enough to drive, but maybe it's not like perfect, like, oh my God, high quality vision. Then all of a sudden they get glasses and they experience what like high definition hyper acuity looks like. Then they wear those glasses for some time, take them off, and all of a sudden they feel like their vision's worse. Well, it didn't cause a worsening power shift in their refractive error, but it created a mental comparison difference. They just didn't know how good vision could have been at the beginning, and now that they're seeing in this high definition vision, taking the glasses off, they're like, things look so much worse without them. So again, it's more of a mental shift. Now, I know we've covered a bunch of different stuff in today's video. I think the final kind of thing I want to comment on is that while this video and many things online kind of talk about, again, these eye exercises to improve vision, these exercises are very different from what is called vision therapy, or sometimes referred to as orthoptics. And that is a completely different subspecialty in the field of eye care, which are still oftentimes eye exercises, but they're a form of kind of eye exercise physical therapy in a way that's used to help people who have eye muscle movement disorders, such as having strabismus or an eye turn, where a kid may have their eyes turning in a different direction, somebody has double vision, or somebody is recovering from a brain, neck, or head injury or a stroke. Those exercises are not strengthening the eye muscles per se, but they improve the neural communication between the brain and those muscles so that they work in a more coordinated manner. And that can help reduce symptoms of double vision, of eye fatigue, of like dizziness and motion sickness, lots of different things. But again, that's a whole other subspecialty, and hopefully we can bring on some specialists to do future videos on that specific topic. But vision therapy or orthoptics doesn't reverse the need for glasses or myopia or anything like that. It's not going to change the axial length of the eye. Okay, so it turns out this creator ended up making an update video that he posted maybe a year and a half, 2 years later after the first one. And interested to see what kind of questions he answers and what information kind of he shares with us.
Don't trust everything you find on the internet, but still try to be open to new ideas and try it for yourself. If your ophthalmologist, your eye doctor tells you that it doesn't work, it means that there are no studies confirming the efficiency of eye exercises. But on the other side, no good studies have shown that it doesn't work.
Okay, so a couple things to comment on here. First, I think he makes a good point that don't believe in everything you see on the internet. Absolutely true. Also, kind of he's saying don't knock it till you try it in a way. Well, as an eye care professional, whether it's an ophthalmologist or optometrist like myself, you do need to follow evidence-based guidelines. You can't just kind of throw stuff out the window, otherwise you end up losing your license, especially if somebody gets hurt or something in the process. Funny enough, I actually did try a lot of these eye exercises, not just the ones he said, but a lot more that have some bona fide evidence, because there is quite a bit of research around vision therapy exercises for ocular motor dysfunctions, whether it be accommodative insufficiency, convergence insufficiency. And I tried to make a full YouTube video on eye exercises in reversing the need for glasses. And I was attempting to do that before I ended up having my own ICL eye surgery, because I wanted to see, hey, could I change it before I go through a permanent procedure? And I do still plan to kind of make this video and release it, but I will give you a heads up. What I did is I did the full research on doing axial length measurement. I did all the cycloplegic refractions. I did all my divergence ranges before, all this stuff to prep for it. And when I started doing some of the exercises, I started having new symptoms. My migraines were being aggravated. My visual snow symptoms were being aggravated. I was having a lot of issues. And so I thought, hey, I need to pause for a moment because things are getting worse. And then I ended up consulting and seeing one of the most well-respected neuro-optometrists in the country. And at that evaluation, I learned things about my eyes, my anatomy, my neck, all sorts of things that I didn't know. I had to kind of pause that, and I honestly need to finish my entire kind of exercises on my own for that to finish before I can make a full video on it. It's going to be a big one, so thanks for giving me a moment to explain all that.
Look at this, for example. This is the most common study people point out to convince me that it doesn't work. 10 participants perform an active eye exercise task which involved following a white square on a black background. First of all, a study with 10 people is not representative. Second, the exercise was to look at a small screen and move your eyes from one corner to another. Very questionable choice of exercise. And third, the assessment method is not measuring eye strength, which means it's not even the subject of the study.
He does make good points about the research studies, like the fact that 10 people in a study really isn't that much, right? You need a lot more people, and typically in eye care studies, once you hit over several hundred, you're getting to thousands and thousands of people, like in the ARED studies. Those studies are trusted a lot more. While that being said, there are professionals, even in kind of the eye care space, that do sometimes make claims that eye exercises do work. And usually they're referring to the neurological connection and improvements in vision stability, improvements in contrast sensitivity, improvements in eye motion tracking. There's a lot of things where various eye exercises or vision therapy or orthoptic exercises can benefit things. In fact, there are real programs that have even FDA clearance here in the US for helping improve vision and components of how our eye muscles and our neuro eye system works. In fact, I'll probably do a whole video kind of sharing more in depth about what these programs are, how to get access to them, kind of where their limits of what they will help and won't help with. But I think a big issue at heart, while I know this video is going on for a long time because it's a big thing that's debated here on the internet, I feel like when it comes to eyes, we don't know everything. So I think of it like the alphabet, right? All the letters in the alphabet, in the English alphabet, we don't know all of them because eye doctors and professionals, we know a lot of it, right? We probably know most of the letters in the alphabet. We're not God or anything. We don't have all the answers. But when people are trying to do these exercises and go through these programs without fully understanding the anatomy, understanding the neurophysiology, it's like they know a few of the letters, they know 10 of the letters, and then they have a couple of wingdings thrown in there. And then they try to make conclusions of how the rest of the alphabet looks. And unfortunately, that leads them down other kind of theories and ways that don't make sense with the rest of what we know of how the eye and physiology of the eye, and then again, the neuroanatomy works. And then, of course, you have the fact that placebo effect is the strongest medication that we have.
Let's move on to the questions. Should I stop wearing glasses? No. If you need them for driving, reading, or your daily activities, please, for the safety of all of us, keep them on. An important point is, go get glasses that are slightly weaker than you need them. And when your eyesight improves over time, go get new ones. I personally only wear my glasses when I'm driving the car or participate in courses to read something from the board.
Okay, so I do want to comment, there is like a string of some gurus online who will claim, hey, whatever your glasses are, just ask for your doctor to write it for a 1 or 2 steps weaker, and then that'll reverse your need for glasses, or that'll help in some way. That I don't agree with if your doctor knows obviously what they're doing. We did go to school for a long time. They should be following the right protocols. The problem is that if you're over-minused, which I hate to say a lot of people are, people have too high of myopia prescription or prescribed to them, then backing off a few steps of that may do just fine, because most people are probably walking around using their eye muscles too strongly. If your doctor is not over-minusing you, then all you're doing is basically making things more blurry, and it's not going to necessarily change your prescription overall long-term. You're purposely making your glasses wrong and your vision less good.
If you get dizzy or get headaches when doing the exercise without the glasses, then keep them on. But if you don't have any problems doing the exercise without the glasses, just put them down. Because these exercises are not only to move the eyeball for a better blood circulation. While moving, your eyes adapt to the new point of focus, which trains your eyes as well. How is your progress now? Well, first, this eye exercise challenge was only for 30 days. I moved on and tried to do other challenges for this channel, and that's why I wasn't doing the eye exercises very often. Until now, I think I only did them for 10 days in total. By the way, this is my current spherical eye strength.
Okay, so he just said that he basically only did the eye exercises for 30 days when he first posted the video, and then since then he's only done them for like maybe 10 more days, and his prescription went down an extra quarter step in all of that time. That tells me that it's not working the way that people are thinking it's working. It has nothing to do with blood circulation to the eye muscles or the eye. It is likely just placebo effect, or in combination with the fact that he was probably over-minused or going through accommodative spasm in some way. Those are kind of my speculations, because otherwise, if he wasn't doing them, why would his prescription continue to change? Plus, as you can see there, he has some cylinder correction, which means he has astigmatism. That's a whole other thing. When people claim that they corrected their astigmatism with eye exercises, I question what astigmatism did they really have before. Are there other physiological changes going on? Because we usually don't see that change too often. I just want to add here that the whole debate that eye exercises improve vision have been going on for over 100 years. And yeah, there's definitely doctors in the field who are very much absolutely against it. I definitely lean that direction. I think there's always more to learn. Like, for example, I go to a lot of conferences, I give lectures on topics in eye care, but I also go to professionals in their own little niche around vision therapy, around pediatrics, where I specialize more in ocular disease, dry eye, anterior segment things. This is an area I think is fascinating. And there's so much about ocular movements and our neuroanatomy and how it controls our eyes. There's still things I'm learning. I think there always will be. And so I try to keep an open mind, but there's a lot of grift in this area of eye exercises and coaching programs and things to try and get people to believe that you don't need glasses and you can just reverse everything. And I think that bothers a lot of professionals. And so I can understand why people are so very much naysay around it and not being as more open-minded. But hey, if you've stuck around this far in the video, please do me a favor. If you liked today's video, hit the like button. If you didn't like today's video, hit the down button. That's fine with me. But even more so, leave me a comment. Let me know if you've tried eye muscle exercises and you've noticed some changes. Let me know, though. I want to hear those stories. Or if you just have other questions about eyes, glasses, refraction, anything like that, right? If you want me to do a video on explaining what over-minus really means, if there's enough people commenting about that, I will make a video on it. But otherwise, I found this video to be rather entertaining, but not really built on trustworthy medical science. Either way, if you want to learn more about finding the right pair of glasses, about picking out lenses, anything to help you see sharper, check out my other videos coming up here to the side. And until then, keep an eye on it, and we'll see you in those videos.